Okay, so I thought I would do an update, a medical update. I really hadn't planned on doing a whole lot more of these, but I'm still having issues with the hiatal hernia surgery and the Nissan Fundoplication. And the main thing that's going on is I'm still getting heartburn and I'm coughing when I'm eating solid food. So I had a meeting the other day with my surgeon. She was going over the test of a esophagus test. I forget the exact name of it, where you have to swallow a bunch of different liquids. You swallow a couple pills, and then they measure how long it takes to get down your esophagus and things like that. So in that results of that test, they concluded that there was no aspiration. It didn't look like there was any problem with me swallowing. Now, the indication of aspiration when I'm eating is it could be minute particles or getting into my lungs when I'm eating, and that's the aspiration part of it. So she says, well, that doesn't show up. I said, well, it doesn't happen when I drink liquid. It only happens when I eat solid food, and I didn't eat any solid food for this test. It was only just liquids. So she suggested a different test, which they give you a variety of different things to eat and swallow. It's basically the same thing. Instead of just doing liquids, they do solid foods too, and soft foods and things like that. So she didn't schedule me for that. I have an appointment. Today is Thursday, May 11th. So I have an appointment on Monday, on May 15th, with a new gastroenterologist. I dropped the other one, who was kind of doing stuff, because I think he kind of dropped the ball on things. One of the things that he mentioned after I had the surgery was to do an H. pylori test. Now, H. pylori is a bacteria. And you generally don't get that. Generally, it's something you get when you're younger, and it just kind of stays with you. It is treatable, but he should have done an H. pylori test. He should have taken a biopsy when I had my endoscope done before surgery. And that's one of the things that they do, to rule out surgery. Because if I had H. pylori bacteria, I wouldn't probably have needed surgery. So I figured he dropped the ball on that. Then when I complained that I'm still having heartburn, his response was, well, we'll give you the H. pylori test now, which is a stool sample test. The problem with that is you can't take any antacid or anything for 2 weeks. And I said, that's not going to work for me. I said, there's no way that I'm going to go 2 weeks without famotidine. The surgeon put me on a new medication called metoclopramide, which is, the brand is Reglan, which is kind of the same thing. It's to treat GERD, gastroesophageal reflux disease. But I'm still getting heartburn. And with two types of heartburn medication, I shouldn't have anything. I'm still taking Tums, even with that. So now, and I got rid of that doctor just because he scheduled that test for me. And then he said, well, I'll see you in a year. And to me, that was unacceptable. He should be still involved in what's going on, considering I'm still having problems with heartburn. So I went to my primary and I says, look, I want a new gastro doctor. So he set me up with a new appointment, and the doctor that I'm seeing is actually the head of gastroenterology at the hospital. So I see him on Monday. So my surgeon suggested that possibly I need another endoscope, which to me that'll be 3 this year. It's possible that something was missed in the first endoscope that I had before surgery. I don't know what that could be, but I got a message the other day that they're scheduling me for an endoscope on July 3rd. So I still have that I have to deal with. Now the coughing, she doesn't really know what's going on with the coughing. Again, like I said, the aspiration is not supposed to be there on this esophageal test that I had, but I'm not eating solid food. So she doesn't really know. Now, I know initially going into the surgery, she told me it was an 80% success rate. So I guess I fall into the 20% that it wasn't a success. The Nissan Fundoplication turned out fine. I no longer have any kind of acid going up into my throat at night when I sleep, into my sinuses, which was the main reason I went for the surgery. So that part of the surgery was a success. The hiatal hernia surgery doesn't look like it's successful, especially, and I just don't understand why with 2 heartburn medications for acid reflux, I'm still getting heartburn. So there's going to be some underlying thing going on that maybe they didn't catch or maybe didn't find out. I don't know. Now they want to put me on she wants to put me on a proton pump inhibitor and stuff like that. I have to run by my nephrologist, kidney doctor, in other words, because I do have stage 3 kidney disease. So any kind of medication I take, I want to run it by him to make sure that my kidneys aren't any more damaged than they already are, because kidneys can't heal themselves. Once you get to a certain point where your kidneys get damaged, they can't heal themselves, and you have to try to. Now, I've been maintaining my kidney level for the past year. I've had tests every 3 months, blood tests every 3 months. My kidney level is stable right now, but medication can kind of throw that off. So you gotta have to kind of watch what kind of medication you take, because I'm a firm believer in the reason that I had kidney disease is because I was taking famotidine and a proton pump inhibitor at the same time. They're telling me that's not the case, but if I go back and look at my records, my blood tests and things like that, that's about the same time I started taking both of those two every day. Now my surgeon is saying, well, she has dozens of people that are doing that and it's not affecting them. I don't know. I don't know what caused it. I don't know what would have caused me to have kidney disease. But again, I have to be careful about what medications I take. So I actually asked her to contact my nephrologist. I said, can you contact him and just run this by him? Because, I'm a believer that these doctors should be talking to each other. The gastroenterologist should be talking to the surgeon. The surgeon should be talking to my nephrologist. They all should be kind of working together to solve this problem. Because when you get too many doctors involved, the ball is dropped somewhere. Like my primary, he told me from the very beginning when I was going in for lung cancer surgery, he goes, I'm not going to get involved in any of your other doctors. He goes, I'm just here in case you need me for something, for physicals and things like that, which I appreciate that because he's not a specialist. He's a general practitioner, so he's letting the specialists deal with what they need to deal with. My whole thing is I wish they would take it upon themselves to talk to each other rather than me having to say, hey, look, can you contact this doctor? Can you contact that doctor to find out what's going on? So I think maybe I've accomplished that, by having them talk back and forth. Another point that I wanted to bring up, which kind of ties into that, is, don't be afraid to get rid of a doctor if that doctor is not working the way you want him to. That's the reason I dropped my gastroenterologist. He kept talking about fasting all the time, especially when I was on that. Now that's his thing, is that he believes in fasting. And he kept mentioning that after I got out of surgery, when I'm already on a restricted diet, I can only eat soft foods for 2 months, and to try to fast on top of that was just an impossible thing to do. You're already really restricted on what you can eat, and I didn't really appreciate that, type of consultation with him on that. So anyway, that's where I stand with that. Still battling the heartburn, although the acid reflux is gone. So we're going to have to see on Monday, what this new gastroenterologist has to say. I'm scheduled for the endoscope in the July 3rd, actually. I'm scheduled for an endoscope. And then, before that, at the end of June, I have my 4th and final CT scan for lung cancer. So if everything shows up negative on that, I don't have to go back for a year. I have been going every 6 months since I had surgery, and everything's been fine. So this last one means I don't have to go back for a year after that. So I'm just so tired of these 3 and 4 doctor's appointments every month to try to deal with 3 separate issues that are going on: the lung cancer, the kidney disease, and now the heartburn. So that's the latest update on that. If you had these surgeries and you're still having heartburn, I don't really know what to tell you at this point, because I don't have any answers myself as to why I have it. I don't feel that I should have it with the 2 medications that I'm on. So there's something underlying that is being missed by me continuing to have heartburn. I've tried changing my diet. I've kind of watched what I'm eating, what I'm drinking, and it doesn't really matter. The first thing I do in the morning when I get up before I even do anything is I take the famotidine and the Reglan, along with a baby aspirin and something for my for high blood pressure, because that's another problem with kidneys is high blood pressure. At first I thought it might have been the baby aspirin because my stomach was empty. Maybe the baby aspirin was causing heartburn. So I kind of stopped taking that right in the morning, and I waited for a couple hours later till after I ate. That made no change at all. The weirdest thing is I get up in the morning, and the only thing basically I've had is that medication and a glass of water, and maybe 20 minutes later I can feel the heartburn starting in my stomach, which is, I don't really get it. I just don't get it at all. So hopefully this next endoscope will be my final one, and it'll have at least have some answers as to why I'm still getting heartburn after the surgeries that I've had. So again, I've had three, and this will be the third endoscope in 1 year. So hopefully they'll find out what's going on. So again, leave me some comments below. Have you had these two surgeries that I'm talking about, the Nissan Fundoplication and the Hiatal Hernia surgery? Are you still having heartburn? Are you still having acid reflux? Leave me some comments below. Let me know what's going on. And I'll probably do another medical update sometime in July after I have this final endoscope. Thanks for watching. Don't forget to subscribe. I'm still working on the motorcycles here. So there'll be another video up on that pretty soon, but I wanted to get this medical one kind of out of the way. So thanks for watching, and I'll see you in the next video.